So the MARIANNE study was one that Sarah Cannon participated in gladly. One of our investigators from London, Paul Ellis, did the presentation last year. And it was interesting. There was some disappointment because the trial was statistically negative. To refresh, this was looking at a baseline regimen of a taxane plus trastuzumab. And then we were looking at the addition of TDM1, trastuzumab emtansine, the antibody drug conjugate, either alone or with pertuzumab. I think there was some disappointment that there wasn't a statistically positive result from the trial. But for the practicing oncologist, the much better tolerated antibody drug conjugate TDM1 did just as well. It didn't do better. And certainly there was less side effects that were seen. So last year we saw comparative toxicities with regard to traditional looking at neuropathy and blood counts and GI toxicity. Well, this year, and presented by Dr. Burris, was the look at patient-reported outcomes. So actually statistically looking at and proving that patients felt better taking the antibody drug conjugate than they did taking chemotherapy plus trastuzumab. I think this is an important subject. The FDA did a presentation here Thursday at a symposium about the patient is the primary endpoint. And I think in this setting, if the therapy is comparable in its result and it's much better tolerated without cumulative side effects, certainly another reason to consider using it for a patient.